Thank you. So now at this time, what I'd like to do is to ask our panelists to respond to any or all of the statements that were just made. Do you have any comments that you'd like to make with regard to the statements, or any final remarks you'd like to make in terms of something that you haven't already said? We'll start with Lori, since she's volunteering.
Thank you for the comments. They were all interesting, and the kids takeover video was very, very nice and well done, and I'm excited about the possibility of the kids being the heroes in their own stories and making those kinds of choices. And I hope that they will become heroes not just in their own personal stories, but that you'll be able to depict them as actors in their community, taking the democratic actions that link together the kinds of changes we want to see both in the food environment and in the physical activity environment, making it sure it's safe, it's accessible, and that people have what they need to raise healthy families. And I think seeing them taking that kind of democratic action would be very inspiring.
Thank you, Lori. Any other comments?
I would just build off of the statements that were just made. You know, I think the child obesity movement is approaching inequities, social injustices, and a desire for a better future in a way that you could not mobilize the resources for adults. And I think if we can keep focused on health outcomes and the energy about what would you want for your child, then I think the energy will come together, Bill, to meet your need for change, and we have a bright future.
Any other comments? Or
I think that all of the public comments were very spot on in terms of some of the issues that we're facing right now, especially this encroachment of the digital world on youth, and trying to tie in kind of what's happening with the federal food programs and addressing the eating and activity needs of youth. And I would also encourage the committee to look at issues of mental health that I think really need to be addressed if we want to see some real changes in this issue.
Very good, very good. You know, before we close out, we've talked quite a bit over the last day and a half about this gap between discovery and delivery of health systems. And it's interesting because yesterday Robert Garcia made a very compelling argument that we should be looking at inequities through health inequities through a civil rights lens. And I'd like to ask each of you, of our member of our panel, to think about, is there one thing that you think the IOM and other groups should do to make systemic changes that would completely overhaul what we're doing today, that could lead the way to truly, truly accelerating change in obesity prevention? Because a lot of what we've talked about speaks to the progress that we're making and the shifts that are happening. But is there something that really we should look more closely at that hasn't been done that we should do, and be that bold voice to be able to put it out there? Ellen's hand went up right away.
I don't know. I don't have the magic bullet. I'm sorry. I wish I did. But to connect back to what Robert Garcia said yesterday, I did mention that one of the recommendations in the area of marketing and advertising is that if voluntary nutritional standards aren't adopted widely in the industry, then we should go after other venues to try to encourage that, including mandatory venues. And I think the question is, can you get legislation, or can you go somehow to the courts and balancing off both First Amendment rights with public health issues? And if there's an issue around which we should engage that concern, it seems to me that the equity issues and how we market to children of color versus others, and the public health concerns around obesity, makes this a case that we really should pursue trying to go and get mandatory nutritional standards for food marketing because it is so powerful.
I think, Celeste, the thing I would add is, unfortunately, our scientific approach is reductionist. We study an intervention and then look to see whether an outcome without having the context of the broader exposure. I think we need some longitudinal evaluations, maybe not with the hard scientific approach, but with the evaluation to say, a child in this environment with these changes ends up here, a child in this environment without the changes ends up there, to actually articulate the difference so that if we have to go to a civil rights adjudication approach, we're building that path, but hopefully we're also building a path to bring up people on so that we not get into the courts and make the changes that we have necessary. It's too easy for people to say, well, that was right over there, but not right over here. We've got to build a holistic approach.
Yeah.
The only thing I would add is, it's not necessarily a new idea, but I think just to remind ourselves of the relatively short amount of time that we've really been doing significant work in this space. And when you're thinking about cultural change, social change, it takes time. And I think we have made a lot of progress in this short decade. And just remind us all that the things that we are doing that are working, we need to continue to do and not let it wane. Even though we haven't necessarily solved it yet, if we continue that drumbeat, hopefully over time we'll continue to make inroads and progress. And you look at issues that we've had at the Ed Council on our docket for 40, 50, 60 years. It's taken a long time to really make those changes, but because we've stuck with it, because other groups have stuck with it, we've been able to overcome it. And so I would just remind us all that we have to just continue doing a lot of the great work that we're already doing.
Okay.
That's right, it does take a long time. If people like to compare in public health to tobacco control, because there's a success we can all sort of just taste, you know, it happened. We've seen a transformation in our lifetime, even though it's still the number one cause of preventable death, but we've made great progress. And the first studies on lung cancer and tobacco were in the 1920s. The first Surgeon General's report was in 1964, and the first report out of the CDC was not that long ago. So I don't know the exact year, but not that long ago. Bill will tell me after the panel. So I think that's important, and I think that the idea that we have to be interdisciplinary here, what Arnell was saying about bringing in mental health and what Robert said yesterday about inviting a few civil rights attorneys to the table to think through the ideas that Ellen just said, which I think are essential if we're going to really make a difference. And we have to reassess the role of government here, because we are in a situation in our society right now where we have started to mistrust the very institutions that we've put in place to create the society that is going to be safe and healthy for everyone. And those institutions have to work for us. They have to be called into account when they're not doing their job right, but they're also the ones that we have to rely on, and we have to give them the information they need so that we can create those environments that we want to live in.
Thank you. Any other comments?
But I always feel like we need to focus on poverty and and deal with issues of systemic racism, and that if we Brown versus Board of Education, looking at what has happened as a result of that, there's been a lot of progress. But if you go into schools now in most urban conditions, they're segregated again. I mean, it's like it's been this this backlash, and so I think that it would behoove us to really look at these issues in depth and work with the education system and others to just have an equal playing field for youth in our country, because right now we don't.
Very good. Rodney, you want to add anything, or?
I would echo what she's saying about poverty, and I like what the approach that Mr. Garcia has. There's not enough talked about with hunger. I think if we solve the hunger problem, we'll solve the obesity problem. The very kids that are obese are very poor, whose parents are unemployed, who have lost their homes, and who come to school and do not finish school because they fall behind, because they started the school day hungry. And if hunger was the worst thing that they faced that morning, they're doing well. Believe me, if you're from an at-risk home and hunger is the worst that you deal with, that kid is doing well. And so we need to put focus on hunger. And you hear all kind of comments in my own community with the summer feeding program. I heard comments about lazy parents and whatever your politics or whatever you feel, don't punish our children. They're our children. And I just would like to see a stronger message about, ensuring that kids get breakfast. And I don't think breakfast is going to solve all the problems of the world, but I think it goes a long way. And I'll give you a little quick anecdote. We just passed testing in California, and we get a lot of calls from principals saying we want every kid fed, here's the budget number. That's not how it works normally. Normally, they want something and they want it for nothing. But because they think there's a correlation between academic performance and a nutritious meal for 1 week, they want to feed kids for 1 week. And I say, woe to us hypocrites. What about the other 360 days that we didn't feed our children? You know, these are educated people that there's no research that proves 1 week of feeding a kid is going to make scores go up. But there is, in fact, research that says that if you feed a kid, they will perform. And yet, as the young lady talked about with FRAC, breakfast is underperformed, summer feeding is underperformed. We worry about all the wrong things. Our focus should be on our children at all times.
It's a great way to summarize. Join me, please, in thanking our panels 5 and 6. And I also want to thank you, the audience, and those of you on the webcast. We now have some concluding remarks from our committee chair, Shariki. Thank you. Hang in there just a few more minutes, and we'll be at the conclusion of this wonderful conference.